pleased to report I got my second COVID vaccine shot this week. Other than an achy arm, feeling pretty good. So let the party begin. Or not. As more people get their first and second jabs, what will it mean to our everyday life? And when will we be able to come out from behind the mask? Dr. Raywat Deonandan is an epidemiologist, associate professor, faculty of health sciences at the University of Ottawa, joins us this morning. Hello, Dr. Deonandan.
Hello, how are you?
I'm well. I've got my 2 doses now. So what can I do?
That's a big question. Now, Health Canada has released some guidance at last, and CDC has some guidance as well. But I would offer that guidance with a caveat, and that is, everyone thinks about this as, what can I do? What does the individual get unleashed upon the world in what capacity? But this has always been a population-level endeavor, and vaccination is about imbuing the community with sufficient immunity that the virus cannot penetrate it. It's not about making individuals bulletproof. So by that I mean vaccines aren't perfect, and as a result their level of imperfection is determined by how much of the community has driven the caseload down. I'm liking vaccination to like wearing high rain boots in a flood, right? The rain boots are impenetrable, that's fantastic, and if the floodwaters are below the lip of your boot, you won't get wet. But if the floodwaters are higher than the lip of your boot, you're going to get wet. So if there is a high level of transmission in your community, it doesn't matter if you're vaccinated or not. Some people, despite being vaccinated, are going to get sick. So let's back up and say that based upon that reality, we have to look at a number of factors to determine what we can do as individuals. We have to look at, of course, are you vaccinated? Number 2, how many other people are vaccinated? And is it 1 dose or 2 doses? Number 3, what's the disease doing in terms of like incidence rate and reproduction number, etc.? And also, how much space is there in the hospitals? Because this has always been about maintaining the survival of the hospital system. So that being said, it comes down to what's happening locally where you live. Long answer to an easy question.
And that makes sense because throughout this whole pandemic, people have said we have to look at it more regionally or even locally just to be able to determine where we go. So would you have specific numbers then, or would it be more trends? Because definitely here in Alberta, we have seen the trends for the fewer ICU beds, fewer hospitalization rates. We've seen slowly single doses, still waiting for more people to do the double dose. But do you put numbers on those things?
I would not, but others can. People who do the modeling can, because it determines based upon the initial conditions where you live, etc. I will say though that if you've got 2 doses, you can probably be indoors with somebody else who's had 2 doses without masks and live a regular life. That most experts agree it's possible. It gets more complicated though when there are other people around you who don't have 2 doses in them. Right? So, and most people are in that situation. You've got kids who can't get vaccinated, for example, or you want to go to a theater or something like that. Yeah, it's so many moving targets here, right? Important to consider as well that the data coming out of the U.S. suggests a couple of things. First is that they're lifting their mask mandates at around the 60% vaccination mark, which some people feel might even be a bit too early because the other factors aren't in place yet. And second of all, what they're seeing on the plus side is that when cases are happening and when hospitalizations and deaths are happening, it's almost entirely in the unvaccinated population.
And when you say 60% vaccination, Raywat, you are talking about fully vaccinated, correct?
That is correct. And nowhere in Canada has that yet.
Well, and also the idea that the masks, because I know I will get texts from people saying, well, if you're vaccinated, Ange, why do you still need to wear a mask? Can you explain why it still is important for me in certain situations to wear a mask?
Right. So vaccines are great. They're almost perfect at keeping you out of the hospital and out of the morgue. Almost perfect. They're really good at preventing symptoms. They're pretty good at preventing infection entirely, but they're not 100% effective at that. So if I'm fully vaccinated and you're not, there is a probability that I can still transfer infection to you, though I would never feel it. You might get sick. If we're both fully vaccinated, the probability of that happening is really quite small. It's not 0 though. As a result, I would wear a mask as someone who's fully vaccinated to protect others who are not fully vaccinated, because I might still make them sick. And the probability of me making them sick is dependent on how common the disease is where I live. If I'm exposed to it, I'm more likely to be able to give it to you.
So I think the takeaway is, yeah, you're still thinking of the greater good. Even if I'm double vaccinated, there will be situations where I probably should still wear a mask until we truly see the back end of this pandemic then when it comes to the numbers and, as you say, the epidemiological information, the health systems, and overall vaccination rates.
That's right. And this sounds depressing to some people who say, we'll never be done with this. No, we'll be done with this relatively soon, sooner than we thought, frankly. This is not interminable. I have a bet with my spouse, who's a family doctor, about when the mask mandates will be lifted in most parts of Canada. I think come Christmas, we won't have mandatory masking. She thinks we still will. We'll see who wins. But I think for the most part, though, we're seeing bit by bit these mitigation tools being lifted. Now, we won't reach herd immunity anytime soon, I don't think, because of the hypertransmissibility of the variants and because of the limitations of the vaccine. As a result, some mitigation tools have to remain in place for those people who remain susceptible. Who are those people? The people who can't get vaccinated, like children. So in schools in particular, we have to be careful about not just masks, but distancing and ventilation, other things like that. The good news is that the outbreaks will be restricted to just those susceptible people, which means we have the public health tools and assets to focus just on those settings.
Dr. Deonandan, thanks so much for this.
Thank you.
Dr. Raywat Deonandan is an associate professor, epidemiologist, and faculty of health sciences, University of Ottawa.